Well, hello and welcome to today's episode of Ask Me Anything on Series 3 of Breaking the Taboo. And regular listeners may know the voice of my next guest, who is Dr. Kim Thomas, who is the Chief Executive of the Birth Trauma Association, the charity that supports parents experiencing post-traumatic stress disorder after birth. She also ran the Secretariat for the all-party parliamentary group Inquiry into Birth Trauma in Parliament and wrote the inquiry's report published in May 2024. She's also published 2 books about birth trauma, including a guide for you, your friends and family to coping with post-traumatic stress disorder following birth, and postnatal PTSD, a guide for health professionals. Well, Kim, thank you so much for coming back on the show to listen to what feedback we've had from listeners to the show. And I've got some questions for you to put in the hot seats. And perhaps if we could start with really sort of the most basic question of all, which I've had from so many mums. And that is that many mums have told me that they in fact didn't realise that what they went through during their difficult birth developed into birth trauma until several months later. So perhaps we could start with just talking about what are the kind of signs or the symptoms of postnatal PTSD that any women or families listening today should look out for.
I think the most common one that people will know about is flashbacks, and they tend to happen involuntarily. So, something might set off, a sort of smell or sight or sound will take you sort of straight back to a traumatic moment in the birth, maybe in the operating theatre. And that's something you have no control over. But often nightmares are quite common as well. People don't realise you can have awful nightmares after a trauma, and it won't necessarily be about the birth. You might just have an awful nightmare about, that the baby's died, for example, or you're in some awful sort of situation and you kind of wake up feeling terrified. And a lot of women report that. Anxiety is another big one. So actually just kind of becoming obsessed with the risk to the baby. So is the baby still breathing? Will the baby be safe if I take it outside? Can I let anybody else hold the baby? Some women become very protective about that kind of thing. And some women, in some women that develops to the extent where they're hypervigilant. So which means you're kind of constantly on a sense of high alert, thinking that something bad is going to happen. And then the other sort of common ones are avoidance. So you avoid anything that reminds you of the birth, like watching One Born every minute, or actually even walking past the hospital where you gave birth, or contact with health professionals, anything that kind of reminds you of the trauma. And also kind of generally, it's a more difficult one really, but if you find yourself forgetting bits of the trauma, or you find yourself constantly experiencing low mood or guilt, that can be one of the symptoms of PTSD. Some women experience dissociation as well, that kind of sense that you're completely disconnected from yourself and the world around you. It's kind of quite an odd sensation. Some women get that. And we also hear from a lot of women who find it difficult to bond with their baby. They've been through the trauma and they feel the baby doesn't belong to them. So, all those can be signs of PTSD and therefore kind of worth, thinking about having treatment for them.
That's so helpful. And it was interesting, Kim, when I was reading through all the social media comments and emails that had come in from listeners, particularly on Instagram and TikTok, a lot of people were asking me really practical questions. So if they suspect that any of their friends or themselves are having the symptoms that you've just described, they're still not really clear by looking on Google, like where they should find the correct help, because there's so many different organisations and websites that they could go to. So my next question is, if someone suspects that they are experiencing birth trauma, what's the kind of first practical step that they should take? Speaking to a GP or a midwife or a charity helpline, what would you advise?
I would suggest if it's fairly soon after the birth, so within the first few weeks after the birth, and you're still seeing a midwife, then it's worth talking to your midwife who will be able to make a referral. Otherwise, I'd suggest going to your GP and explaining what's wrong. We have a leaflet on our website called Coping with a Traumatic Birth. And if you think your GP might not understand about PTSD after birth, it could be worth printing that off and taking it along and just kind of explaining really in detail the symptoms you're having. And then your GP should be able to refer you to an NHS therapist. But you're also very, very welcome to come to the Birth Trauma Association and ask for help from us, because we have a trained team of peer supporters who can talk to you about your experience. So yeah, we're definitely worth doing that.
And I think the key point we're both making is actually to ask for help. You reminded me from your previous answer about an episode we did a bit earlier in this series about intrusive thoughts. And we had, a mum and a therapist come on to talk about how that kind of manifested and the types of intrusive thoughts that they had. And it's really difficult, I think, for people to talk about these issues, but there is a lot of professional organisations out there to give them support with both their mental and physical help. So hopefully today is a bit of a signpost to some of those resources. So if we could just stay talking about the kind of mental health side for a bit, I get a lot of questions from mums asking me about the different types of therapies, and we've covered so many of them on different episodes. So CBD, EMDR, trauma-focused counselling. So could you just explain a bit about what are those different types of therapies? And then the second point, which is, I know it's really hard to sometimes find who's the right properly trained specialist in that area, particularly when there's a bit of a postcode lottery on services. If you could just answer both of those points.
So the two main therapies, which are the ones recommended by NICE, the National Institute of Health and Care Excellence, are trauma-focused CBT and EMDR, which stands for eye movement desensitization and reprocessing, which is an awful mouthful. And so both of those are sort of intense therapies that will last, probably between about 8 and 15 weeks. The idea with both of them, particularly with CBT, is you kind of go over the trauma multiple times until you can kind of talk about it without feeling upset or distressed by it. So that's kind of quite difficult, obviously, because you have to revisit the trauma, and naturally most people will feel reluctant to do that. EMDR is a sort of slightly odd one in that it tends to require you to focus either on somebody moving their finger in front of your eyes, or sort of listening to tapping sounds or tones in your headphones. The idea is somehow that kind of moves the traumatic memory into long-term memory, into a kind of place where it feels safe. And nobody really knows quite how it works. But I suppose the things I would say about them are, for some women, EMDR is better. For some women, CBT is better. Some neurodivergent people don't get on very well with CBT. So in those cases, EMDR might be better. Narrative exposure therapy is another one that seems to work quite well. But I think for all of them, the important thing really is to have an understanding therapist. I mean, this is always the key to having successful therapy, is to have a therapist who understands what you went through and somebody you get on with and who is sympathetic. If you go through the NHS, to a large extent, you have to take, whatever the NHS is offering you. But if you're willing to go privately, then there are places you can look. So on our website, we have counsellors and therapists advertising. And obviously, because the advertising is aimed at women who have birth trauma, then those are people who understand about birth trauma. And also the British Association of Counselling and Psychotherapy has a directory that is very good and allows you kind of search for different terms, like birth trauma, or, you can search for somebody local. So, there's both good ways of finding somebody who might be appropriate for you.
That's so helpful. And it struck me listening to what you were just saying, Kim, that there's actually so many different types of therapies. So I think for anyone listening today, I found with my personal experience that it's just finding the right one for you. And it might be that you need to try a few different things. EMDR I found really helpful for processing my traumatic memories of when I thought I'd nearly died post-birth from having a postpartum hemorrhage and from being awake in theatre for over 2 hours. And I suppose the best way to sort of describe it was that it was like the therapist had kind of taken those memories where I really felt like I was reliving the experience, like it was still happening to me again, which made me have so much adrenaline and sort of cortisol going through my system again. And I think now, having sort of processed those memories through that technique, it's almost a bit like I'm watching myself on a kind of DVD or a video playback. So it's a bit like you're kind of one step removed, which takes some of the kind of emotion out of the issue when you kind of reflect back on those experiences. So definitely one to check out. And Kim, thanks for the really helpful links. We'll put all of those in the show notes today so that you guys can find where to find access in your local areas. And I was looking through the comments that come in, Kim, and what's really striking is how many topics have really struck a chord, I think, with the public. And I think one of them is about mums not being listened to. And you and I have talked about this so much, in particular in relation to the birth trauma inquiry in Parliament last year. And in fact, we called our report Listen to Mums because we didn't feel like they were being listened to. So the question I've had in is that some mums struggle to be taken seriously when they raise concerns during pregnancy, labour or postpartum. And the question is, do we have any advice for them on kind of practical language or phrases that would really help them to advocate for themselves in a kind of medical setting?
Yeah, this is a difficult one, actually. I think the way I would suggest to deal with this is to kind of make sure you're as well informed as you possibly can be before you go into labour or into an appointment with a midwife or GP, so that you understand fully what you're talking about and you kind of make it clear to them that you understand what you're talking about. If you can go in armed with nice guidelines, that is kind of really helpful as well. Say, well, this nice guideline says this, this is what I should be entitled to at this stage, or this is what I think is wrong with me. I think it's really helpful to write down notes before you go in, so that if you forget or you get flustered about what you're going to say, you can refer to your notes. I would suggest asking them to make a note of what you're saying as well, so that it goes into your medical record that you asked for this, because there's always the worry that afterwards they will say, that you didn't talk about it, or they'll record the discussion wrongly. I think it can be worth taking somebody else in with you as well. Somebody who is also kind of well informed, who can advocate for you if you feel unable to kind of, for whatever reason, to talk about what it is you want. I think all those things are really important. But it can be difficult because, women do so often tell us that they weren't listened to. Beyond kind of repeating calmly and clearly the same thing, it's not always easy to know what to do. But I think that, that's the best kind of advice I have, really.
Yeah, and I think you're making a really important point as well about preparation. So reading about things in advance, planning what you're going to say in the meeting, having notes. And I've heard that from so many mums that they're kind of in the heat of the moment, or when something's gone wrong, they find it really hard to advocate for themselves. So having kind of talked about it in advance of your partner, I think is really key. And just talking about partners, we do have a lot of dads also listening to the show. And a question that we've had is more for families who've been involved in a traumatic birth. So the question we've had from a dad is, how can the dad get support while also being there for the mother's recovery?
Yes, and it is harder for dads to get support because they're not asked, they're not kind of routinely asked by a midwife or health visitor. So I'd suggest, again, going to your GP, and we do have a leaflet on our website for dads and partners about traumatic birth. So again, it can be helpful taking that with you, because I think there's probably some resistance still to understanding that dads and partners can be traumatised, or indeed other members of the family can be traumatised as well. But you're entitled, if you're having symptoms of trauma or PTSD, you're entitled to have a referral to therapy, and it works in very much the same way as the therapy for the woman who gave birth. And there are other forms of support available as well. So if you want to come to us at the Birth Trauma Association, we do have a dad on our peer support team who's had his own traumatic birth experience and is able to talk to you. And Scott Mayer, Fatherhood Solutions, he does bi-monthly Zoom drop-ins for dads on our behalf. Which is just kind of safe space for dads to talk about, how they feel having witnessed a traumatic birth. So I think, those are all good things. There's probably not quite as much as we would like, but, there is some help out there. And do visit our website, because we have got a page on dads, and that has got links to the resources as well.
Well, I'm so pleased that you mentioned Scott, because in fact we had him on the podcast in an earlier series with another dad from Dad Matters, talking about some of the charities work that they do with fathers. And just remembering back to that conversation, I think what really struck me talking to those two dads was how this is really not discussed in relation to birth at all. Because I think there's such focus on us as the mum being the patient, and then of course the newborn baby, that sometimes the dads have witnessed some really horrific things, like the partner nearly dying in childbirth or something happening to the baby, and they feel that they've really got to be strong for their partner, and they can't be seen to be vulnerable and asking for help. But it's absolutely okay for them to do so too. So do check out that that episode if anyone's listening and specifically wants to hear from two dads talking about their experiences. And we like this podcast to be really practical and kind of solutions focused for families listening. And something I've had a lot of questions about is about hospital debriefs. I know some hospitals don't currently offer them, but a lot do. So if parents are interested to know how do they get access to their notes, how do they review kind of what happened during birth, what would you advise, Kim?
Yes, and obviously if your hospital does offer a birth debrief, it's worth doing that. Though I would also say, manage your expectations, because some hospitals offer very good debriefing service, and in some hospitals it's sort of less reliable. But I believe NHS England is kind of rolling out debriefing services to all hospitals now. So everybody's entitled to ask for their notes. So there'll be email address or a data controller on the hospital website. You can send in an email asking for your notes and that of your baby. So ask for both sets of notes, and legally they are supposed to send them to you within a month of you requesting them. Doesn't always happen, unfortunately, but that's what they're supposed to do. And then if you haven't got a debriefing service at your local hospital, then it is kind of quite tricky, but there are private midwives who offer a service of going through your notes with you, and it might be worth doing that. And I think that's just kind of question really of Googling and seeing who might be available to offer that service to you, because you do really need an expert, because a lot of the time, it won't be clear what those notes mean. So I think it is worth doing just for your own kind of peace of mind, really, to understand what happened to you.
Yeah, no, I think that's so important. And I had a birth debrief. And for anyone who's wondering what that is, what was really helpful about it was an NHS professional basically had printed out my hospital notes and spent about an hour going through with me the timeline of what had happened in labour. And obviously, as Kim's saying, there's a lot of kind of medical terminology and things I didn't understand, and where they talked about drugs that I'd been given and other checks that I'd had. So actually having a real person to speak to and explain to me the kind of timeline of what had happened really helped me with processing what had happened to me. And if anyone listening is having a challenge getting access to your notes, do check out the episode on accessing your hospital records. We actually have a lawyer on from Owen Mitchell who talks specifically about what you should do in that scenario and gives you some really practical advice on how to get access to your notes. So do check out that as well. And if we could turn on to a different topic, just having a look through the questions that have come in from listeners. Oh, this is a good one. So someone has said, after a difficult birth, how can women plan a future pregnancy or future birth safely? And we've had a lot of comments from mums saying that they've been very concerned about their sort of future emotional and physical health. If they've had a really difficult birth first time round, they're obviously quite worried about getting pregnant for a second time. So what would you advise in that scenario?
It is a good question, and so many women who come to us say they won't have another baby because they won't go through that again, which is really sad. But then quite a lot of women who do get pregnant become really anxious, quite understandably, about the prospect of going through a similar experience again. So I think the first thing to do is make sure you have had counselling or therapy to come to terms with your first birth before really you think about having a second baby. And then I would say go into that second pregnancy proactively. So make sure you're informed, you know what your rights are. You don't have to give birth in the same hospital you gave birth the first time. You can choose a different hospital. So you can look around to see if there are hospitals that might be more suitable for what you want. I would make an appointment kind of early on with the head midwife or the consultant and say, look, I don't want what happened to me last time to happen again. What can you do to make sure that it doesn't happen? So to kind of consider your options during the birth. You might want to see the perinatal mental health team if you're experiencing a great deal of anxiety about it. You can ask for things. I mean, for example, we might come to this later, but you can ask for a planned caesarean if that's one of the options you prefer. You could ask for a home birth. You could ask to see the delivery suite, before you go in, just kind of familiarise yourself with it so it doesn't feel quite so frightened. And you can ask to make sure that the obstetric team are aware of the fact that you've had a previous traumatic birth, and that is written on your notes. We actually have on our website trauma-informed care wristbands that you can wear to kind of indicate that you've previously had trauma. But I would say as well, just kind of read up really and make sure that you know what you want and what you don't want, so that you can kind of make that really clear as well in your birth plan, and just make sure that everybody who's looking after you is really well informed about your particular needs.
And just listening to what you were saying, Kim, I mean, I know as a mum who'd had a difficult birth, I think going back to the same hospital I found incredibly triggering. And I've heard from other mothers too that, giving birth in the same hospital can be really challenging for them. So maybe it is that you want to go out of area and go somewhere else, or as you've suggested, go and give a tour and see what it's like. And I think it's, any information is helpful, and it helps you to kind of feel a bit calmer about the whole situation. And you mentioned just then about caesareans, and I've had a question come in asking, is it reasonable to request a planned caesarean after a traumatic birth for psychological reasons? And they're also interested to know how they should kind of start that conversation with their sort of care team within the NHS.
Yes. So, yes, it's completely reasonable, and it's also completely within your legal rights as well to ask for a caesarean. And so one of the things I would do is to kind of look up the NICE guideline on caesareans. I think it's NG 192, and there's a paragraph in there that talks about your right to maternal request caesarean. And there's also a lot of stuff in there about, that they can offer you therapy, or they can kind of talk it through. In other words, they can try and talk you out of it if they want to. But ultimately, if they try and talk you out of it and you still want to do it, then that is within your right. So having that conversation, I would just be very clear and very calm and explain, that you've been traumatized in your previous birth. You don't want to go through that again. The NICE guidelines say your right is to have a planned caesarean. I would just keep repeating that. I think sometimes that's the only way. Whatever they say to you, you can just keep saying, well, this is what I want. And some hospitals will be absolutely fine about it. Some hospitals won't like it, but ultimately that is your right, and you can insist on it. So yeah, that's what I would advise.
And I think you're making an important point there, Kim, about women knowing their rights ahead of birth. And I know we had some instances of mums in places like Oxford who are being denied a C-section in their local hospital and going to other parts of the UK like Manchester. So I think for anyone listening who feels like they're not being listened to a healthcare professional, keep reiterating the point, as Kim is saying, you are entitled to ask for this, and please do so. Okay, if we could turn on to a slightly different angle. This is less along the medical lines, but obviously I've written a book, as have you, Kim, and we've had a few mums write in about kind of self-care beyond therapy. They're particularly interested in the fact that we've both written and talked about our kind of creative practice. So the question is, do you have any suggestions on what might also help them with recovery, which is kind of beyond therapy, so kind of other things that they can do really from home?
Yeah, I think that's a really nice question, and obviously it depends on you as a woman and what your own preferences are. I've really been interested since becoming part of the Birth Trauma Association at the number of women who take up exercise, particularly running, and it seems to be something to do with having felt that your body failed you during birth and regaining control and understanding your body is powerful. So we've been very lucky actually that lots of women have chosen to run races first, marathons and half marathons, and get a huge sense of achievement from that. So running is one thing, and other forms of exercise like yoga, swimming. Obviously we have Jill Castle who swam the Channel. Not everybody's going to swim the Channel, but I think those are really good exercises to do. But then, creativity as well, just writing. A lot of women find it really helpful to write about what happens to them. We know quite a few women who've written and self-published books, or they've written poetry, art as well. We had a lady in the group called Rosalind Batty who did these kind of really beautiful pictures of her birth trauma. And I may have mentioned before Kath James, who does these amazing embroideries of her birth trauma, which has been her way of working through trauma. So I think there are all sorts of things you can do, really. And if you've always fancied doing pottery but never done it, why not take it up? I mean, I think this is a good kind of time to do it, really, to think about what's going to help me in my recovery. And creativity is a fantastic way to do that.
Well, I totally agree. And actually, I'm interested you mentioned Kath, because I finally met her, having watched, seen her videos and posts on Instagram when she came to the Every Woman Festival in Cardiff, where we did a live episode from the Women's Health Festival. Well, I totally agree with that. And actually, I just add as well to anyone listening today, do take up journaling. I mean, you don't need to be writing a book or trying to get published or having, your words in the public domain, but literally just go and buy yourself a little exercise book, something cheap and cheerful where you can just sort of write your notes down and your thoughts, reflections on the day or the week. And it might just be a few sentences or a paragraph or two. Although in my case, I started writing and it ended 100,000 words later. And went into my book. But I think you're so right that I think writing it down, Kim, in a way is almost a form of therapy, even though I didn't write my memoir for that reason. But I do feel like it's almost downloaded onto the page, kind of what my thoughts and reflections were of this quite a difficult time in my life. And also makes me realize how far I've come with my recovery and healing, which I hope is very much the kind of message of the book. So we're coming towards the end of the episode, and I'd just like to be signposting listeners to where they can get help. So if anyone's listening today and they really want to find access to resources for kind of reliable, compassionate help, particularly if they feel like they're not coping today, could you just talk a bit about the work of the Birth Trauma Association and the charity work that you do, and where mums can find free resources?
Yes, of course. So we support people through peer support. So we have a Facebook group that's got nearly 20,000 members now. It's really active. Women are very good at supporting each other on that group. And, we just talked about journaling, but a Facebook group is a great way to share your story as well. And lots of women get a lot of help just from writing down their birth story and having other people, understand it and comment on it and say, I had something similar. That's really helpful. And we have a great team of peer supporters who answer emails. That address is support@birthtraumaassociation.org.uk. They've all had traumatic births themselves. They've all been through a process of recovery, but they all understand, when you write to them, they will understand what you've been through and be able to help you. There are a couple of other supports that we offer. So we're currently piloting a WhatsApp support group, which has been really successful. Details of that on our website. And we're, fingers crossed, we're about to relaunch our Zoom drop-ins, which we used to do, and then we had to pause for a while, but we're hopefully starting those again soon with our peer supporters. So there's kind of range of support, really, depending on what most appeals to you, whether it's talking or writing. Oh, I should say we have phone support as well. I can't remember the name off the top of my head, but again, that's on our website if you prefer to talk to somebody in person.
Well, that's incredibly helpful. And, as an affected mum, that's how I first came across the BTA, was finding your Facebook group. And I think you made a really important point there, Kim, about peer support. And I've definitely found this both myself and talking to other families. I think it really helps you to feel less alone when you speak to somebody that's had a similar experience. And also you can ask some questions about how they dealt with their recovery, whether it was some kind of mental or physical health. And I noticed we didn't get any questions in this week on birth injuries, but we have talked a lot about that on previous episodes. And that's something as well that a lot of mums have questions about. Well, Kim, thank you so much for coming on today's episode and answering listener questions. I think it's really helpful to have those really precise answers to the questions that are coming in. And if anyone listening today wishes that their question was being considered to be talked about on the show, then please do drop me an email via my website or drop me a message on social media. We do read all of the comments and messages coming in, and it very much informs future topics for the show and for episodes like this on Ask Me Anything. And if you've enjoyed today's episode of Breaking the Taboo, then do consider rating it on Apple iTunes or Spotify, and do share the links with friends and family. We want to find and help as many people as possible. So thank you for joining us on today's episode of Breaking the Taboo, and stay tuned for next week's episode. Bye-bye for now.